Hello and welcome back to another episode of the Private Practice Growth Club YouTube channel, where we share tips, tools and tutorials for health professionals starting and growing a private practice in South Africa. Today's guest is SteHan, Botha, who will be representing Docotelo today. Thank you for joining us today, SteHan. How are you?
It's my absolute pleasure. I'm very well, thank you, Taz. Busy day as yourself as well, but I'm so thrilled to be here and to chat with you about this very important and interesting topic.
So you and I connected actually last year already. The date of recording is 19th of February 2025, and we connected in 2024. So this has been a long time coming, so I'm glad we finally made the time to make this happen. So let's just start off with you explaining to everybody, introducing yourself and telling us who you are and what it is you do.
So I have the privilege of working with Docotelo now for, I think, just over a year. And it's one of my clients, and it's just been amazing to see the development. I basically come from a design background, marketing background, and brand strategy background. But I've also in the last year or two been very involved with digital products, software as a service or SaaS products, and helping to launch them, position them in the market, and helping to promote them. So that's what I've been doing for Docotelo. And the reason why I contacted you is because I did a Google search and a YouTube search, and I did a Facebook search trying to find someone in South Africa who is bringing together private practice owners and doctors and medical practitioners. And you came up, and we've been chatting ever since and connecting and looking for a time to do this. So I'm thrilled.
That's amazing. And, it's quite funny because sometimes people will come up to me and say, yes, and I know you from your YouTube channel. I think health professionals South African health professionals aren't very engaging in public platforms online. So they're not the type of people to comment on videos a lot. And so I don't always know, are people, besides the stats, obviously I can see there's views, but I don't actually know, are people actually finding it useful? Do they watch it? Until somebody will come up to me and say, I watched all your videos and it's helped me so much. I've been binge watching it. And then I feel like, okay, this is motivation to keep going. And then of course, people like yourself who will find the channel and find ways to connect. So it's been a great networking tool as well. So on that note, explain to us, so what is your interest actually in health practitioners in private practice specifically?
So just starting from Docotelo and the purpose for starting the app, it was developed with a medical doctor who just saw that there's a problem. He's got his own practice. One of the biggest challenges in medical school is you don't get taught how to run a business. You only get kind of prepared for working in government hospitals and that whole sector. But he actually wanted to be his own business, his own boss. He wanted to have his own practice, and he found that the incumbent software that's available out there wasn't quite what he wanted. And he wanted something new that is cloud-based, that is flexible, that you can check online, on your phone, on the move and on the go. And there wasn't a great selection of software in South Africa or affordable options. So it kind of came from that point, and many of those values to kind of democratize technology. It's something I'm passionate about. And to obviously establish a brand and a product and to position it well so that more people can know about it. And it's just, I got connected and introduced through this medical doctor and through one of my clients. And we headed off, and I was able to do a strategy workshop with them and then position it. And now I'm trying to get as many doctors and allied health private practice owners to connect with Docotelo and try it out for themselves, see if it works for them. And so that's what I'm doing at the moment.
So of course, because you come from outside of the medical professional and private practice industry, it's always good to have kind of what we call a fresh pair of eyes on a problem, right? And private practice is not easy because, like you said, we're not trained in business, and to start a practice is basically starting a business. We go to medical school to learn about the clinical aspects of how to treat a patient. And there's a little bit that's touched on in fieldwork in terms of fitting into a team, but it's usually the education is geared towards working in public. So now that you've come into the space and had to work with the software, you had to kind of understand, well, why did this particular doctor find that this was a problem and feel the need to fill that? From your perspective as an outsider, what do you see are some of the biggest obstacles or problems that practitioners face when they enter into the world of private practice?
Yeah, it's a very good question, Taz. And I think part of the reason you'd probably know this yourself is this dichotomy of working in your practice or your business or on your business. I mean, this concept of not being able to do both at the same time is a real challenge for any business owner, and especially so for someone who's in the healthcare, where you have to be face to face with a patient and you have to spend your time and attention on them. And while you're doing that, you can't promote your business or you can't actively work on it. And so this allows for you to be able to have a bird's eye view of, over a period of time, you can actually put all your information in one place. You don't have to go around looking for it. So it saves you a lot of time. I think time is one of the biggest challenges, like a lack of time. And as you know, you probably work as a medical doctor or a health practitioner. You're on your feet most of the day, sometimes deep into the night. And often you're busy working on admin. You're busy with files and with clinical notes, and you have a lot of insurance admin often, and things that only you as the medical doctor or clinician can approve. And so we wanted to find ways of streamlining that process and also not having a ton of paper lying around that you have to keep track of and file. Just an interesting anecdote from one of our earliest customers was a nutritionist and dietitian, and she often had so many records and papers and things that she actually told me she would have to have an entire room or 2 rooms full of paper and filing cabinets, because she needed to hold on to those files for a certain amount of time. I think 5 years is kind of the minimum. And it's just impossible. I mean, I see a lot of people who work for themselves, but especially in the medical practice, who have all these papers. And often when you want to find something, it's really hard and it takes a long time. This is like a searchable option. Everything is digital. You can literally have everything scanned, back scanned, which is not part of our core offering, but we do offer this. We can literally have entire rooms or trucks full of paper scanned within a week and uploaded to Docotelo. Anything that you have on record for a patient can be linked to that patient and can be searchable so that you can find it, because time is not only money, but time is also life. Sometimes you need to act fast as a healthcare professional when someone's life and health is in danger potentially. You need to find allergies, information, you need to find other critical factors quickly, and this helps to do that.
It's interesting that you mentioned that, because literally just yesterday I saw a post in the Private Practice Growth Club Facebook group. I mean, it's like over 3,000 people and it's growing now. It's a closed Facebook group. And somebody had asked the question in there saying that they are looking to go paperless, but what's the best way to go that route? Like, do they have to scan in everything and upload that to the cloud? Is that sufficient? Can they then, destroy those documents once they've done that? And like, also just the time that it will take to do that. So it's amazing to know that there's actually services out there that will scan on your behalf and reduce that admin load for you. But like you said, I think it's more the long-term time saving in the fact that you have easy and quick access, because a computer can search an archive of information much faster than you can, no matter how organized your cabinetry is. But then aside from the actual running of the practice, what are some of the other, obviously, if you're starting a private practice, there's the running of the practice, but you don't have a business if you don't have patients. And from a marketing point of view, that would be, bringing in customers, converting interest into customers. Do you see any difficulties that the people that you've come into contact with have in terms of actually starting a practice and then building up that clientele, building up a patient book, where, some practitioners are sitting there twiddling their thumbs because they have so many empty slots of appointments? Like, what are some of the difficulties you found in that regard?
Another great question. So what I've seen so far is what I've already mentioned in terms of lack of time for actually spending the time looking for patients or promoting your business, promoting your brand. Or very often it's a personality thing. Not everyone has that outgoing personality to go out there and talk about their business or to go and sell. Like it's seen as somewhat beneath a medical doctor to go and sell, right? It doesn't seem fitting to do that. But besides that, it's often just a case of they don't know where to start and they haven't been trained in it. And so you're kind of making it up as you go along. It's very hit and miss. And often they just rely on word of mouth, which is a great thing if you've got it, but it often takes time to do. And you really do need a digital footprint. Just as an example, my wife is a clinical psychologist and we moved from Cape Town to George, and initially it was during COVID, so everything had moved online, even, Zoom calls as opposed to in-person meetings, which was a blessing in disguise for her because she could just pick up and essentially build a practice here. Now it's all kind of tipped the scales, and it's people in George tend to want to see you in person, or they'll drive even from Neisner rather than have a Zoom call. So that is very interesting. And I think one needs that as the starting point. We actually identified that besides the platform of Docotelo, which can be part of an existing website of a doctor or allied health professional, we also think we're going to be branching out into helping doctors to have their own websites, as part of that. Something that you mentioned, we've talked about this. It's not currently part of our main offering yet, but our next version will have the ability to let patients book themselves, because right now we're giving the doctors access and they can manage everything from the back end. But we've had this conversation. People are busy, If you've got a situation and you need to book a doctor, even if it's the middle of the night, you need to be able to do that. So we're very excited about our next release. We're going to be having that as a feature. And so anyone that joins now will have first access to that. And so there's things like that, because you've actually said, I've been thinking about our previous conversations offline, that experience, that first impression you have with a medical doctor, especially when you're in need, there might even be a crisis, there might be some stress involved and real risk to not have someone you can go to, especially if you've got a trusted doctor, but you can't get an appointment for weeks or months. It's a real problem. And then you end up like going somewhere else or having a compromised experience. Whereas this really allows for much better first experience, first impression in terms of booking and making sure you can know what you expect from a doctor or from a practice.
Yeah. And the funny thing about word of mouth that people tend to forget is that in order for there to be word of mouth, there need to be mouths first. Where do those mouths come from? Like somebody needs to first know about you well enough. So it's fine, good and well to say word of mouth is an effective marketing tool if you're are an established practice. But if you are brand new, where are those word of mouth referrals going to come from? So there's always a starting point. So where your marketing, you still need to implement other marketing methods in order to get the brand awareness or the awareness of your business out there. And so what you mentioned there, whether it's to do with the booking system or the website and all of that stuff, and it's something that I often present on around developing a brand, is the customer experience. So, and the customer experience isn't only when they're sitting in your office, because they first need to experience almost tidbits and develop a perception of whether they feel like they would be happy to come to you before they even land up in your seat. So what are some of the things from a marketing person's point of view, that are small things that can help a medical professional sort of develop a strong brand that is palatable to potential patients, that will make them, perceive that this is a doctor or a physio or an OT or a psychologist that I would be happy to try, because you don't know until you come and you have to pay for the service. So it's a risk on the patient's part and I think with a GP, it's not so bad, because usually I just want to get my antibiotic and I can go to another doctor next time. But if it's an emergency, it's emergency, right? I'm sick. But with professions like your wife, like psychology, it's a long-term commitment, and you're not going to fix the problem in the first session. So you do risk that you're going to you're going to waste your money, so to speak, if you go to this person and they're not the right person for you. How do you know? So what can private practice owners do to kind of leave those pebble stones so that the person gets a good customer experience right from the point where they start to consider you as a practice?
Excellent question. And obviously it goes far beyond what Docotelo can do. This is a bigger question, and it goes even beyond the medical field. It's interesting. There was a study done by Google. I don't know if you've come across this, Tasneem, but they did a study on how people buy, how people decide on making a decision to go with a service provider or a brand or whatnot. And usually it's like a person. What do they do in order to make a decision that they feel good about making? And people do their own research now. So they don't just go necessarily even on word of mouth, although that's a very powerful way of getting referral. They've got this formula that they discovered called 11-11-4. And 7-11-4 stands for 7 different 7 hours of content that you need to have out there on the internet. Whether it's video, blogs, you need to be able to keep someone busy and reading and getting to know you in some way or form through content of roughly 7 hours. They've kind of like figured out this is the magic number. So 7, and then 11 is to do with how many different touch points people have. So what you were describing earlier is really the customer journey, isn't it? And it starts way before you enter the practice or even land on the website. Maybe you'll find something on social media about someone. If you could, as a practice owner, muster up the courage to either make a video or write about something that you're passionate about that's helpful to someone before they enter your practice, that's going to be a key, to just give away some of that information that you've worked so hard for, to not always have to charge for it, to be able to get that information out there that could help someone. Obviously, there are certain things where you can't give medical advice in a blog post, but there are good principles that people are looking for online. So help them find that information and then associate you with that great experience. And if you're in the area and they come across your name on some other touch point, they'll be like, oh, I read this guy's article. Okay. And that trust gets built. And so 7, 11. So 7, just to recap, is the 7 hours of content to keep someone busy and getting to know you. I mean, that's literally the time it takes for someone to get to know someone else and to trust, or to know, like, and trust them. So even me and you, we've probably been communicating for over 7 hours cumulatively over time, just through voice notes and through WhatsApps and emails and me watching you on YouTube. That made me want to get to know you a bit better. I trust you. I like you. I reach out. And in the same way, 11 touch points could be anything from, like I said, a blog post, a video, a tweet here. People want to get to know you in a non-threatening way. And they do that kind of from a distance. They do their own research. And in their mind, as they see you, as they get to know you, and again, associating you with helpful information that you're giving away for free, that builds goodwill within the customer or potential customer. And that all adds up to a kind of bank account, if you will, of trust. And then the 7, 11, 4, and the third piece, which is 4 different platforms. So that's kind of the magic number of, if they've seen you on YouTube, so it goes beyond the touch point. It's like the platform itself. If they've seen you on Facebook, they've seen you on YouTube, they've seen you on Instagram, and maybe even on Pinterest, or they've met you in person. That's 4 platforms, if you will. And within that, you get all these different touch points that you can literally do different kinds of content. And that's what people need. And that's what they base their decision on. So best to start making that in some way or form and sharing that. And that's going to just be to your benefit.
I don't know if you've listened to podcasts, Diary of a CEO, Stephen Bartlett. He recently interviewed for the second time, I think his name is David Priestley, I'm not sure. And he also spoke about that 7-11-4 concept. So
Daniel Priestley. I heard it from, yeah. He quoted the Google study in
this
podcast.
So it's Daniel Priestley, yeah. So
Daniel
that is a great
from
podcast
Australia.
So, I mean, that is a great application to the medical profession, of course. But, even though that's not necessarily specific to Docotelo, because Docotelo is more the back end, I think it's also what you're speaking about there is a very time-consuming effort, like to do those things, right? And so I think where the beauty of leveraging softwares or services that can save you time in the administration of your practice means that you then have more time to do all these marketing things, right? And then also, when you mentioned like the multiple platforms, a website, like you've mentioned before, is one such platform. We do live in an age today that if you don't have some form of online presence, that you will be left behind by somebody who does. So it doesn't necessarily have to be a website. I, for one, don't have a website for my practice, but I also use like a booking form, which forms my website. So I think it's great that Docotelo, for example, will come up with, is developing the solution where patients can book, because that can be your form of a website. But if you don't have a website and you don't have a booking platform, then some form of digital presence is really important, whether that is a LinkedIn page or a Facebook page or some way. Lots of people start off with a Facebook page and use that as their website because it can have your hours, your contact information, your email address, all of that stuff. But then there's another element is that in that 7.11.4, when you talk about touch points, the touch point itself is so important, because it's not having those touch points for the sake of a touch point. Because if you follow that 7.11.4 to a T, but every time somebody comes into contact with you or your services, it's a negative experience, it can have the reverse effect, because it's having the same effect of
Absolutely.
7-11, but in a negative way. So, and it's much harder to shake a negative perception than it is to build a positive one. It's much harder. So once you have a negative brand image, it's going to be very difficult to regain trust from the public. So what are some of the things that you have found that the medical professionals, that before they come to Docotelo and they are stressed and they are overworked and they are not managing their admin and they're not managing the clinical notes, from your perspective as an outsider and also as a spouse of a medical professional, what do you feel that impact, how that has as an impact on the service delivery and therefore the patient experience, which then has an impact on word of mouth, referrals, etc., has on a practice?
Again, you got some great questions, Taz, and I think I'm going to start answering that one by just looking at a human being beyond a medical doctor, but we can take it to that and personalize it. But anyone who is bogged down, like, the hours that a typical physician or medical, someone who works with people all day, every day, they are just tired at the end of the day. But then they have to now still file a bunch of papers or potentially scan something, or they need to look for things and they can't find it, or they have to. If you do that once, it's okay. But if you do this over a week, a month, a year, eventually what you have is someone who's fatigued, someone who is probably a little bit grumpy, and someone who has to make decisions that are, life and death decisions, but they really don't have the bandwidth and the capacity to do that. And so I think it's actually a very important responsibility to make sure that you have systems in place that help you to do your job in the best way possible. And also, like I mentioned, the patient experience is something you mentioned. Something that I've found for a lot of medical practitioners who consult with their patients, they want to be able to sit across them and look at them and make notes, like physical notes. And they don't want to type in a laptop. And we hear people may object to having a digital system. They say, no, but I don't want to sit and type while someone's telling me about their health. And you don't have to. Like, the wonderful thing is you can either have an iPad where you have a pen, but you don't have to be that fancy. If you literally write something on a pad and you want to look them in the eye, this accommodates for that, because you can have it scanned and it's uploaded and it's searchable. You don't have to compromise the experience with your patient. And I think that's always wonderful if you can maintain that. High touch is what they call it. So you get high tech and you got to match high tech with high touch. And so all of those things and how quickly you get back to someone. Say, for example, you've got a client or a patient, and it's maybe an elderly parent, and the children phone the practice to find out what were the results of a certain test. And often it takes days, sometimes weeks, before you hear back, purely because of disorganized admin. And that puts a lot of strain, obviously, on someone who needs to know, is my father healthy? Is he going to be okay? What are the results? And so what if you can quickly and effectively and efficiently answer those questions, because you've got it at your fingertips, or your staff support personnel has it and they can access that information quickly and easily? That puts someone at ease immediately, and that forms part of the experience. And then they'll tell that story to someone else, and that'll attract more patients and grow the practice. So each one of those touch points are extremely important.
That is some great points. That what we have to realize is we live in a world today where people are very instant gratification, convenience. I mean, our whole world is set up for convenience. You can check your 60/60, pick and pay ASAP, Uber, Eats, Mr. Delivery, like everything is instant and immediate. So I find that myself, I'm extremely impatient when it comes to, I need something, I need it now. And so the point you make about, like, a doctor or a professional having access to your information and your folders and all of those things, it can be a real deal breaker when you go and see someone and they look like disorganized. It can look unprofessional. But so, SteHan, you've spoken a lot about, the touch points and how making the customer experience less frictions and also saving time in the administration of a practice gives the health professional more bandwidth to manage their patients more effectively and actually execute on that good customer experience. And we mentioned how technology and software such as Docotelo can actually assist with that. But there are many different practice management softwares out there. So what makes Docotelo different, or what are the features that Docotelo offers specifically that can speak to those pain points?
So I would say beyond just the software itself, having spent time getting to know the founders and the people behind Docotelo, people don't really trust in brands or in technology as much as they trust people as they get to know them. And I had the privilege and have the privilege to work with some of these people myself and have seen their hearts and seen how they really want to make a difference in the lives of practitioners. And then that has a beautiful knock-on effect to the lives of patients and everyday people like me and you. So just from that perspective, having the opportunity, like we mentioned, you as a person who has been in a situation where you've needed certain functionality from booking an appointment, etc. Like you actually, I think I've said this on a voice note to you earlier, is like you have the opportunity to help shape Docotelo as a person who uses it or could potentially use it or is someone who's knowledgeable of people who are using something like that. And so you literally have an opportunity now where Docotelo is quite young. They're keen to adapt to the needs of real practitioners and doctors. And I have seen and surveyed the landscape of practice management software. And so far, I can't say I've seen everyone because competition is quite stiff, to be honest. And there are a lot of incumbents who have been around for years. I won't mention any names, but some practice software that literally has been around for about 20 years and they haven't redesigned about anything. They've added a lot of stuff on there as they went along, but it still looks like Microsoft Office 2000 or 1995. And a lot of these limitations where if a practice is kind of involved with practice software, they have to be bound by contracts. It's physically bound on the PC that's in the practice. So we wanted to go like fly in the face of all of that. So what we offer, and often the expense of some of these licenses are unbelievable what people pay. I literally had a conversation with a doctor where they shared with me that they spend about 20,000 Rand on software like this, and then they haven't even paid their accountants to do their books and things like that. That's a huge burden on a practice, especially if one is starting. So we wanted to help mostly new medical doctors who want to go on their own, and perhaps people who are open-minded enough to go digital. Not everyone is comfortable with that. So someone who is willing to be comfortable with that, so it's definitely cloud-based, digital first. It can make room for starting with analog and scanning papers and things like that. But essentially, we wanted to make it affordable. We wanted to make it accessible. We didn't want people and doctors to feel bound for years or even months. We've got a month-to-month agreement. If you're not happy for any reason, give us feedback, but you're free to go. There's no chain and ball holding you back for years and years. Another thing we found is often our competition typically makes it extremely hard for someone to export and extract their information once they sort of have been using a certain software. You can't find, like, people merge and migrate to Docotelo, but then they can't get the information out. And then they have to pay huge fees for someone to help them get that, out. It's their information, but yet they can't really access it. They don't own it, not truly. So we wanted to break down those barriers and those walls, make it easy for people, not make them feel like they're signing away their life and having to draw. It's like, make it easy, like make it affordable. Really, there's very little software out there that does what Docotelo does for under 1,000 Rand. And that's what we've been aiming to do. And that could be an entire practice with staff. And so it's really affordable. We want people to thrive. We want their businesses to thrive. And then the other thing is implementation costs. Very often the companies will come and they'll maybe make the subscription or annual fee attractive, but then they'll ask exorbitant fees to install and implement that software into the actual practice. And then they make it that way. It's really shocking. It's really unnecessary. In this day and age with cloud technology. It shouldn't be necessary. So in those ways, saving money, saving time, making it easy. And I think that's the key. that's what we want to do.
So I'm glad you mentioned about the affordability factor and saving money, because my experience with health professionals, I mean, I'm one myself, but just from my community, is that we do tend to be penny pinchers, usually on the wrong things, unfortunately. I mean, like as an OT, for example, OTs love spending thousands on all these fancy assessments, from America and all of this stuff, when you are the main tool, really. But then they will and ah over whether they should sign up for a software or an accounting package or an accountant, or, and these are important aspects of the business because we are so clinical focused. So it makes sense to us to spend on things related to the act of providing the service. It doesn't make sense to us to spend money on business related expenses. So what would you say would be the opportunity cost of, why should a doctor invest in paying a monthly fee for a software? What would be the opportunity cost of not doing that?
So first off, I just want to say what we also offer is one entire month free to try Docotelo, which is nice because often doctors are busy. Any medical practitioner is busy. Allied health, you're spending your hours in front of people. You're selling your hours, you're selling your time. So I've literally recently had a doctor who just wanted to get it as soon as possible so he can spend time over the weekend to get to know it and then make a decision on whether or not to sign up. But he has an entire month to do that because he's busy and it's hard. So there are many, many people like that in that same situation. So first of all, we make it super easy to try it out at no risk at all. We'll take all the risk. You just go ahead and try it and see if it works for you. Hopefully within that time, you can see it works and then you sign up and off you go.
So medical practitioners will tend to see a subscription-based service and think, oh, I don't want to spend money on that because I'm to save money. So if they don't sign up, like what is the cost versus the opportunity that they would get by having that? Like although it's not money they're taking out of their bank account, giving out, there is money that is lost in not having a system. So what would that be for you?
I mean, that's the kind of thing that's super hard to measure, right? You don't know what you're saying no to. Similar to the examples that you've given before, where you don't even know someone was trying to reach you, trying to make a booking. For whatever reason, you're busy. There's not enough people answering the phones. There could be many opportunities lost that way. And I think even looking at Google today and, look at Google ratings and Google reviews, they speak book volumes in terms of what to expect. People make a judgment call, like a snap judgment based on things like that, your reputation online. And I think if, again, all these things aren't in place, the systems aren't in place, your documentation and your admin isn't easy to access and quick to find something you're looking for, everything has a knock-on effect and takes longer, has an impact and a drain on your staff, which impacts your time of service, making people wait either in the practice or, at home waiting for information, or being able to have to book you, but they have to wait 2-3 weeks. Sometimes, often specialists have waiting lists for weeks ahead. And it's not just to see people, it's all these other things that, the ecosystem around a practice. And you never know just how much you're actually saying no to, either leaving money on the table or the ability to impact people more or to have a good reputation, because people make a decision based on that one experience. And they'll go to Google and they'll give you a 1 star because that's the least they can give you, just because they haven't had a good experience. And especially people are vulnerable and emotionally charged around their health. And it is so important to make that first impact. So I think it's really about that first impression, but then also the ongoing consistency over time, because you build trust over time. And people will come to you and they know what to expect. If the service experience is the same, if they know they have access to their information, their data, their health data, and it's easy to access. It's not like you have to sign a million forms or ask a lot of, permissions or cut a lot of red tape or wait a long time. You feel more reassured as a patient. And I think that all has a very good effect. And not having that is obviously, you take a big risk. You potentially lose out on impacting a lot more people.
So I think it sounds like from what you said that at the crux of it, it's really about time. If you, yes, it's difficult to measure what you don't have. You don't know what you lost, so you can't quantify that. But the way I see it is, if you can say, okay, having this software saves me X amount of time per week, and you ask yourself, what is your hourly rate? And let's say on a low end, I mean, OTs get the lowest rates from the schemes. I don't know if you know that, but I compared rates across all the professions for Discovery, and we get the lowest. So if you take, like, say, Discovery's rate, a 1 hour treatment session is 577 Rand. That was 2024 rate. And if even if I say 1 hour a week, that's 577 Rand, which, if I say 577 per week, that's already 4 times more, like maybe 3 times more than the subscription I would have paid. So
Absolutely.
you can
No,
actually quantify
you can.
having it versus
I'm
not
glad
having
to bring
it.
it up. Exactly. So you can actually, once you start saving that money or that time, you can easily translate it to your hourly rate. That translates into several, hours and rands earned back over weeks and months and years. But
Yeah.
really, as you were talking, as I was thinking, it took me a little while to get my bearings and my train of thought. But those things that are truly valuable, if you think about it, if you're a mother, or a father, and you have a family, or even if you just have a spouse or someone that's special to you, if you're working as a doctor and you're doing all these extra hours and you end up not being there in the moments that really count, that is a huge opportunity loss. Like special events, I know many doctors struggle with that because their life is so much run by their career that they end up spending most of their career just working, and then they miss out on beautiful moments, a child's recital or a dance or a sports event, being there for them, supporting kids when they're young, and then they need that support. And I think if you can free up time, in the end of the day, the most valuable thing is the time you can't get back. So I think for me, this gives an opportunity for people to structure their practice in such a way that it doesn't rob them of the quality of life beyond the practice. And this is the biggest thing. It's not really about the practice as much as it is about beyond practice and the rest, the life outside of that, and to gift that to yourself. I think that's the biggest gift that Docotelo can give to any medical person.
I love that. I think that's so important, that you can't replace it, right? That's the one resource that we can't replace. You can replace money. It's not easy, but you can replace it. Whereas time, you can't replace. Once it's gone, it's gone. So that is such an excellent point. And if you think about, I don't know what the stat is, but I attended a webinar around women in healthcare once, and, women actually make up the majority of healthcare professionals by a lot. They outnumber men by huge numbers, even though males take up the predominant of the more specialist kind of leadership positions. Because of the factor of time, traditionally society is in such a way that women tend to take time off to be with their families, etc. So that is an excellent point, that even as female health professional, if you can have a solution that can save you time so that you can find more of a balance and not have to give up your career aspirations because you
That's
also
so
want to
powerful.
have a family, that can be such a game changer. Yeah. I think it would be great if we could have some kind of demo of the platform. So yeah, if you can record something like that and we can put it up on, I do have a practice management software demo playlist, because I think, like, it's helpful if somebody can see what it is and what the features are. And not everything is for everyone. I mean, like, as a therapist, like, I have something called a good fit meeting where people can come and first see, like, maybe we don't gel, and that's okay. And then I can refer you to someone else. So
Yeah,
sometimes people do, and then they can decide, okay, based on what they've seen on the demo, I'd like to maybe sign up for a trial and then test it out myself.
yeah,
So that would be
sure.
great if we can provide that.
With pleasure. I'll send that your way. Thank you so much, Taz. Appreciate it. It's been wonderful chatting to you.
Thank you.
And
Thank you.
yeah,
Bye.
just wonderful to chat to your audience as well. So thank you so much.